Welcome back to the OHSU Effect Inside Health and Science at OHSU on FM News 101 KXL. Good morning. I'm Lacey Evans. Right now, we're going to tackle a pretty hot topic, LASIK eye surgery. Is your once clear vision now a little blurry? Do you have trouble reading those street signs? Well, should you get eye surgery or is there another option? Are contacts safe? Safer than LASIK? Well, with me now on the OHSU Effect is Casey Eye Institute surgeon, Dr. William Mathers. Good morning.
Good morning.
So I'm glad we're doing this topic because I wear contacts. So I want to know a lot about LASIK. So, obviously we have three options here. We have glasses, LASIK, and contacts if we have some vision problems. So what are the factors that we should consider when we're choosing one of those options?
It is easy for young people to wear contacts, and it is not appropriate to have laser surgery when you're very young. You really need to be stable and in your adult years, in your 20s.
And is it because our eyes are still growing, or what are the reasons for that?
There's two primary reasons. The eyes are still changing, and early on you may not have any or show any evidence of your eyes being unstable. But we would want to know that if you were going to have laser.
And any other factors when we're choosing between contacts or laser?
No, the tear film is best when you're young, so contacts are easier.
Mm-hmm. What is the more cost-effective solution? Because LASIK can get kind of expensive.
Oh, there's no question that laser is cheaper.
Oh, really?
Oh, yes. I mean, a couple of $100 a year for your contacts, maybe a little more, but you're going to wear those 30 or 40 years. You add it up. I mean, it's obvious that laser is a lot cheaper.
Both contacts and laser are safe, but people are worried about the risks for both of them. And I know you studied that. So can you kind of lay out the risks for both contacts and laser?
The main risk for laser surgery is not what you would think. It isn't infection or surgical mishap or problems with the instrumentation. It's actually the risk of lasering an eye that is not going to respond normally, and you have to be careful to detect this beforehand. So some eyes should not have laser surgery, and that's the main risk of laser surgery is missing that detection.
Can you say why simply? I mean, what kind of eye can't have the surgery?
Some corneas are predisposed to have a bulge or a thinning effect. And sometimes this isn't evident early on, perhaps not until your mid-20s. But if those people have laser, that will get worse and could be very serious.
Wow. What about the risks associated with contacts?
They're better understood, and the main risk is infection. You have about a 1 in 3,000 chance during your lifetime of having a serious infection such that you actually lose vision in that eye. And that's a pretty substantial risk, whereas the risk of laser surgery is somewhere around 1 in 5,000.
Is it a temporary loss in vision, or could it go either way?
No, I'm speaking about a permanent, significant loss in vision, which includes potential loss of the eye. The infections with contacts tend to be much more severe and greater vision loss than the problems associated with laser. The laser risks really aren't that bad.
So would you say contacts are riskier then?
Yes, contacts are riskier.
It sounds like it. Well, do you mind if we talk about the procedure for LASIK? I think a lot of people, including myself, are a little nervous about it. So can you briefly say what a person would go through if they are interested in getting the surgery?
When we speak of laser surgery, we usually mean LASIK.
Okay.
LASIK, which creates a flap, either with a metal blade or now with a laser. This flap is lifted, and the laser energy is applied to the surface of the eye to shape it so that the light will be properly focused. You lay the flap back down, it heals, and then you can see. It sounds like it's a lot, but it only takes a few seconds to do those lasers, and it doesn't hurt. It is, in some ways you can imagine it's a little bit frightening. But it's okay. Most people do fine.
And what about the recovery time?
Well, you can see immediately after LASIK surgery, certainly by the next day. If a different procedure is done where you don't make a flap, you just laser the surface, you can see, but the vision isn't sharp for a couple weeks.
So both of these kinds of vision correction contacts and LASIK continue to evolve. I mean, where do you see the future of this going?
Hopefully, they'll both get safer over time. Contacts are safer now than they were, but they could be made safer. There's no question about that. I think that laser will also be made safer and actually continues to be so because we didn't have a treatment for this unstable cornea problem, and we now do. So that is going to make lasers safer, and that's a good thing.
What about, the long-term impacts of LASIK? I've heard that people who get the surgery may still need reading glasses down the road. What are the long-term impacts we're talking about?
Laser surgery should make you like a person who has good distance vision. And that means when you're 45 to 50 years old, you're going to be wearing readers like any normal person. It doesn't solve that problem. I wear glasses because I'm over 50, and there's no way out of that unless you use one eye for near vision. But a lot of people don't tolerate that. I don't.
Yeah, can you do just one eye at a time, or would you recommend doing both?
We used to do one eye at a time, but it has become so reliable and so safe to do this that mostly we do laser surgery both eyes at the same time, but you can certainly do one eye at a time.
Mm-hmm. Well, again, I know cost sometimes is prohibitive for people. What other research are you doing up there in terms of LASIK and contact use?
Well, we continue to research different infections to improve our understanding of them, try to make contact lenses safer, and improve our treatment for these infections because they really can be devastating. And with laser, we try to enhance our ability to detect which patients should be done. This is a very critical thing. This is the practice of medicine, and you need to be careful.
Is there anything that people who wear contacts can do to prevent the infection?
Absolutely. But it is just the wearing of the contacts that is the essential problem. So many infections occur even though you're doing absolutely everything right.
So washing hands, making sure everything is safe, things like clean when you're putting the contacts in your eyes.
That's all important.
Yeah.
And managing the solutions and not using old solutions, that sort of thing. That's all critical, but it still doesn't get around the essential risk because contact lenses interfere with the tear film, and that puts the eye at risk.
Let's talk a little bit more about the surgery, talking about prepping patients and what they'll have to go through. Anything else you want to add about that?
Well, as I said, it sounds a little scary, and it is sort of a weird experience, but actually everybody gets through it just fine. And usually people are given a little bit of sedation. The preparation is quite minimal, really. A couple of drops in the eye and some wipes around the skin. So it's not that difficult. It's just that it involves your eyes. And
right.
You know this is important, and you know that you need to be careful.
Are there any guidelines? I've heard that people shouldn't wear their contacts up into the surgery, that you ask them to wear their glasses. Why is that?
It's very important that we have a stable eye so that you can get the right measurements to determine exactly how much laser to do. And sometimes contacts can affect the eye quite a bit. The thing is, you don't know how much an individual person is being affected by their contacts. So it is best to either have the contacts out for maybe a week or two and check. And if there's any sign that the contacts are affecting the eye, wait and recheck until you know that it's stable.
How can people get a hold of you if they're interested either in the LASIK surgery or just more information on contacts or getting a safer contact for them? How can they find that out and get a hold of you?
I'm at the KCI Institute, and that can be called. It's in the phone book, or our laser center's number is 503-494-2839.
So easy to get a hold of.
Easy.
Dr. William Mathers, thank you so much.
You're very welcome.
Coming up in just 5 minutes on the OHSU Effect Inside Health and Science at OHSU, we're going to talk to a doctor at Dorenbecher Children's Hospital. With flu season here, Dr. Don Knoll has advice for parents and what they need to know about vaccinations. But if you missed Dr. Mathers or Dr. Tabacco or Dr. Amon earlier in the show, you can hear the podcast at KXL.com Also, check out www.ohsueffect.org. Also, is there a health topic you'd like us to cover on the show? Send me an email, lacey.evans@kxl.com, or follow me on Twitter @LaceyEvans. Send me your suggestions. Stick around. Dr. Don Knoll is next on the OHSU Effect, Inside Health and Science at OHSU. This is Lacey Evans. You're listening to FM News 101 KXL.